Narayana Health City has achieved a breakthrough in advanced heart care, completing over 100 robotic cardiac surgeries in just 1 month. This milestone showcases world-class surgical expertise, clinical precision, and the power of cutting-edge robotic technology, delivering remarkable outcomes for both adults and children. Among these complex cases was a 45-year-old patient who had previously undergone coronary artery bypass grafting, or bypass surgery. He later developed a tumor in the upper chamber of the heart, a condition that can obstruct blood flow if not treated on time. But performing a traditional open chest surgery again can be extremely risky, especially when earlier bypass grafts are still functioning. To avoid damaging these grafts, the surgical team chose a robotic-assisted minimally invasive approach. Through a tiny incision on the right side of the chest, surgeons used robotic instruments and high-definition 3D visualization, accessing the heart without reopening the breastbone. A remarkable example of innovation, precision, and life-saving care, setting a new benchmark in cardiac surgery at Narayana Health City.
The robotic cardiac surgery is one of the most advanced technology we have in our healthcare system, and the robot has entered cardiac surgery almost about 2 decades ago, but in the meantime it has got fallen out, and now like in the last almost for about 8-9 years, like the robotic has entered the cardiac surgery. So we now, like in the initial phases, like we have been choosing the cases, right cases for the robotic procedures. But as when we keep pushing the boundaries, soon in future, most of the cases we will try and do by robotic system. And to know like which is the ideal patient as of now, like we choose the patients like whose heart function is good and no anatomical challenges, and his vasculature is good. So we choose these 3 patients for the robotic procedures. And as we discussed, like for the robotic system, like for the CABGs, for the coronary artery bypass grafting, where the lungs has to be good, because we do most of these cases in a single lung ventilation. So if they can able to maintain oxygenation with a single lung, yes, we go ahead and do it through a robotic system. And other challenges is the vasculatures. They should not be like a peripheral vasculature has to be good. There should not be a calcium burden or atherosclerosis burden in the peripheral vascular system. Yes, those patients we choose for the robotic procedures.
Dr. Kiran, Senior Consultant Cardiac Surgeon, Narayana Health City. ನಾವು ಆವಾಗಲೇ ಹೇಳ್ದಂಗೆ ಈಗ ಮುಂಚೆ ಆಗಿದ್ರೆ ನಾವು ಈಗ ಕಂಪ್ನಿ ಎಲ್ಲ ಅದು ಪ್ರಮೋಟ್ ಮಾಡಿ ಪೇಷಂಟ್ಸ್ ಕೇಳ್ತಾ ಇದ್ರು ಸರ್ಜರಿ. ಬಟ್ ಇವಾಗ ಪೇಷಂಟ್ಸ್ಗಳು ಅವರೇನೆ ಎಲ್ಲ ಅದ್ರ ಬಗ್ಗೆ ತಿಳುವಳಿಕೆ ಮುಂಚೆನೆ ಎಲ್ಲ ಮೀಡಿಯಾ ಕಡೆ ಗೂಗಲ್ ಸರ್ಚು ಅದು ಇದೆಲ್ಲ ಕಡೆಯಿಂದ ನಾಲೆಡ್ಜ್ ಪಡ್ಕೊಂಡು ಅದನ್ನ ಕೇಳಕ್ಕೆ ಬರ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಅದರ ಅಡ್ವಾಂಟೇಜಸ್ ಅಷ್ಟೊಂದಿದೆ, ಹಾಗಾಗಿ ಪೇಷಂಟ್ಸ್ಗಳು ಈಗ ರೊಟೀನ್ ಆಗಿ ಕೇಳಕ್ಕೆ ಶುರು ಮಾಡಿದ್ದಾರೆ. ಪ್ಲಸ್ ಅದು ಫೈನಾನ್ಸಸ್ ಕೂಡ ಅವರು ಕೆಲಸಕ್ಕೆ ಜಲ್ದಿ ಹೋಗೋದ್ರಿಂದ ಅದು ಏನು ಅಲ್ಲಿ ಲಾಸ್ ಇರುತ್ತೆ, ಮಿಡ್ ಲೈನ್ ಸರ್ಜರಿನಿಂದ ಮುಂಚೆ ಏನು ಲಾಸ್ ಆಗ್ತಾ ಇತ್ತು ಅದನ್ನ ಅಲ್ಲೇ ಕಾಂಪನ್ಸೇಟ್ ಮಾಡ್ತಾರೆ. ಅಟ್ ದ ಸೇಮ್ ಟೈಮ್ ಇದು ಎದೆದು ಮೂಳೆ ಸೆಂಟ್ರ್ನಲ್ಲಿ ಕಟ್ ಮಾಡಿದಾಗ ಇನ್ಫೆಕ್ಷನ್ ಚಾನ್ಸಸ್ಸು ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ಇಂಥ ಮಿನಿಮಲಿ ಇನ್ವೇಸಿವ್ ರೋಬೋಟಿಕ್ ಸರ್ಜರೀಸ್ನಲ್ಲಿ ಅದು ತುಂಬ ಕಮ್ಮಿ ಇದ್ದು ಜಲ್ದಿ ಕೆಲಸಕ್ಕೆ ಹೋಗೋದ್ರಿಂದ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ವೆರಿ ಲೆಸ್ ಪೇಯ್ನ್, ವೆರಿ ಫಾಸ್ಟರ್ ರಿಕವರಿ, ಆ್ಯಂಡ್ ದೆಲ್ ಕಾಂಪನ್ಸೇಟ್ ಆಗಿಬಿಡುತ್ತೆ ಏನೇನು ಲಾಸಸ್ ಇರುತ್ತೆ ಅದೆಲ್ಲ.